KEA Tutorials presents Gastro-esophageal reflux disease. GERD, by full meaning gastro-esophageal reflux disease, is a condition characterized by flow back of stomach acid into the tube connecting your mouth and stomach, the esophagus. This acid reflux can irritate the lining of your esophagus. Talking about the risk factors of this condition, we have delayed stomach emptying, hiatal hernia, pregnancy, and obesity. When you swallow, a circular band of muscle around the bottom of your esophagus, the lower esophageal sphincter, relaxes to allow food and liquid to flow into your stomach. Then the sphincter closes again. If the sphincter does not relax as it should or it weakens, stomach acid can flow back into your esophagus. This constant backwash of acid irritates the lining of your esophagus, often causing it to become inflamed. This backflow act is what is termed gastro-esophageal reflux disease, aka GERD. The signs and symptoms of this condition are heartburn, epigastric pain, dyspepsia, nausea, vomiting, and dysphagia. Now, let's talk a bit about the diagnosis of this condition. It all begins with physical examination. Effectively, the patient will report pain on palpation of either the epigastric region or the throat. Equally, from the signs and symptoms, we can tell a patient suffering from this condition. Not forgetting history, medical history like a past medical condition like hiatal hernia, surgical history like a past surgery on the esophageal organ, gives us clues on the pathology. Also, some imaging will be done to ascertain the diagnosis. Imaging test like upper abdominal endoscopy, where an endoscope is sent in the esophagus through the nose or mouth to obtain better images of this organ. Also, an esophageal pH monitor, to determine how acidic or basic is the esophagus. The test is considered positive when the pH is acidic, which indicates the presence of stomach contents in the esophagus. Under the treatment options, we have the medical option and the surgical option. Under the medical option, classes of medications like antacids, histamine 2 blockers, proton pump inhibitors, and prokinetics. Under the surgical option, procedures like fundoplication and Lynx device. Under the medical management, we have antacids, like sodium hydroxide, which neutralizes the effect of gastric acids. We also have proton pump inhibitors, like omeprazole, which reduces the amount of acid produced by the stomach. We also have histamine 2 blockers, like cimetidine, which inhibits the production of acid by the stomach by blocking receptors to histamine. And lastly, we have prokinetics, like cisapride, which accelerates gastric emptying. Now, the surgical management, we have fundoplication. During this procedure, the surgeon wraps the top of your stomach around the lower esophageal sphincter, to tighten the muscle and prevent reflux. Fundoplication is usually done with a minimally invasive laparoscopic procedure. The wrapping of the top part of the stomach can be complete Nissen fundoplication or partial. Another surgical method is Lynx device, which is a surgical procedure by which a ring of tiny magnetic beads is wrapped around the junction of the stomach and esophagus. The magnetic attraction between the beads is strong enough to keep the junction closed to refluxing acid, but weak enough to allow food to pass through. The Lynx device can be implanted using minimally invasive surgery. The magnetic beads do not have an effect on airport security or magnetic resonance imaging. In prevention, the patient has to undergo changes in nutritional habits, and some lifestyle modifications. The patient is advised to avoid factors that decrease lower esophageal sphincter pressure or cause esophageal irritation, such as peppermint, chocolate, coffee, fried or fatty foods, carbonated beverages, alcohol, and cigarette smoking. Still under prevention, avoid the use of anticholinergics like atropine, which delay stomach emptying. Also, nonsteroidal anti-inflammatory medications like ibuprofen, and other medications that contain acetylsalicylic acid need to be avoided. Like every condition, improper care can lead to complications. Complications like esophageal ulcer, perforation, and bleeding. Thanks for watching. Don't forget to subscribe to our channel, like and hit the notification icon for YouTube to remind you of our updates. See you in another video.